Hello, I'm Samantha Breedlove, and today we're going to be talking about Amber and the tests that she has been given, the assessments that have been given to determine what exactly she needs in classes. So, Amber is a 14-year-old girl, and she is a ninth grader at Mena High School. She was evaluated in 2018 in November. So, Amber has a younger brother who's 6 years old. Um, Amber has been diagnosed with a specific learning disability as well as ADHD, and then she also has asthma and some other allergies that might affect her during school. So, Amber has been given multiple different tests to evaluate her and see how she's doing, and to help us figure out how we should teach her and what modifications she might need. So, one of the tests that she was given is the Wechsler Individual Achievement Test. This one focuses on her achievement in different skills. So, that would be listening, speaking, reading, writing, and math. So for the Wechsler test, she was given some prompts, and she would respond orally by pointing to the responses to the math problems or the basic skills, just the everyday applications of mathematics. Overall, her math score was below average, so that is something that we should be looking at and figuring out exactly what we need to focus on to help her do well in math. Amber was also given the Woodcock-Johnson Test of Achievement. Now, this test has 22 tests that focus on different specific things. So, Amber was actually given 4. She was given the reading, the math, the writing, and the language. So, based on these tests, Amber's reading comprehension, so when she reads what she understands, was actually in the average range. Her oral reading and written expression were in the below average range. Her basic reading, math problem solving, numerical operations were well below the average range. And so we'll be focusing more on those things and how to help her with modifications in class. Amber is also struggling with her listening comprehension, so she's having a hard time understanding when directions are being read to her or when questions are being read to her. She also is having a hard time with word identification, understanding different passages, and her oral fluency, just her speaking in general. She hesitates a little bit and takes a little bit more time before she responds to questions. As far as math goes, Amber's struggling with algebra, thinking about math problems in her head. She's also struggling with simple addition and subtraction. Multiplication and division are also hard for her. So those are also things that need to be addressed and need to be worked on. Some of the modifications that we will be using based on her evaluation are going to be things like she'll be in a classroom for students that need that extra help, that need less distraction, especially with her ADHD. She needs that more quiet, focused classroom. So we're going to have her in a smaller classroom for that. And she will also need to have the individual classes only for reading and math, which are her struggles. So when grading her papers, spelling won't be counted. We need to look into checking her for dyslexia, because some of her scores showed that she had some characteristics of dyslexia. So we need to do some dyslexia testing with her to make sure that we can get those modifications if she does have dyslexia. When teaching new concepts with Amber, it is important for the teacher to teach it in many different ways instead of just one. That way Amber has a chance to grasp it and understand it. Opportunities for repeated practice and review are also a few things that will be on her modifications plan. And if she is unsure of a word, access to a dictionary or a text preview to help her is also going to be essential for her modifications, as well as preferential seating so that she's not distracted by those outside things. So as far as her classes go, Amber will be in all of the regular classes with all of the student body, with the exception of her reading class and her math class. She'll be in a special classroom where individualized instruction can be given.